COVID-19 the elephant in the room. And it's about the fact that really what we should be promoting in terms of public health messaging is eat real food.
Vitamin D3. Vitamin D3, people in the United States, more than 70% of people, they're vitamin D deficient. It has enormous amount of effect on your immune system. Hi everyone, Michael Petrosian here with American Brand again. In today's video we want to talk about critical thinking. Critical thinking, it requires for you guys to have common sense, look at some facts, look at the truth, and start thinking how everything that is happening and what media, which they're full of lies, they're giving us, and some so-called doctors or technocrats, they're trying to take away our liberty and our freedom. America, it's known for a land of the free and home of the brave. Unfortunately, this has changed, and America is becoming a land of the sheep and home of the slaves. The reason for that is because nobody wants to think. Nobody wants to take the responsibility of having a critical thinking to see what is the reality, what's going on. So today, we are facing with COVID-19, we are facing with pandemic, we're facing with economic depression, and don't fool yourself, this is not a recession, it's a depression. More than 40 million people, they have applied for unemployment. Most businesses, they're going out of business, they can never come back. And we have to see, was it worth it? So I wanted to go over a few things which then we wanted to see if this is a common sense, if this is truth, or this is any reality to it. And let's analyze this for a moment. So when the pandemic happened, Fauci came, Dr. Fauci, who's the head of the NIH, he said that we don't need to wear masks. Then he, in a recent interview he did with CNN, which was on May 26th or 7th, he says that wearing a face mask, it's symbolic. There is no proven science that it protects you against COVID-19. Then the COVID-19, the pandemic, what happened, Fauci said that the entire reason we have to shut down our economy is because we wanted to flatten the curve. This famous flatten the curve, it was supposed to be for 2 weeks. It's been 2.5 months that the economy is in shutdown. And then your governors, your mayors, this disgraceful people that they are power hungry, they try to take away our liberty and our freedom. Now, if we look at exactly what has happened, is that they said they want to flatten the curve. Okay, so if they did want to flatten the curve, you and I, we have to stay home. But they didn't tell us what to do. Stay home so we can flatten the curve so our hospitals, they don't get overwhelmed, which is not a bad idea. However, flatten the curve in New York, which is the epicenter of the COVID-19 in the United States, 66% of people that they were home, they were tested positive for COVID-19. So they said social distancing, they're promoting 6 feet distance. So let's think about it for a moment. Let's have some critical thinking. More than 100 doctors, they have come out, scientists, they have come out, and they debunk the idea that wearing a face mask, it's going to protect you against COVID-19, which is not true. Why? The most simple thing is this. You wear a face covering or face mask, what you do is you, as in right now, I am breathing in oxygen and I am exhaling carbon dioxide. That's the way you live. That's the way you survive. When you have a face mask, what you do is you notice your breathing. In other words, you put a stress on your body, and because of that, your cortisol level goes up and you damaging your immune system. Not to mention that you are breathing not a fresh air, you keep breathing a carbon dioxide back to your body. Now, hundreds of doctors, they came out, immunologists, virologists, scientists, regular MDs, they said that wearing a face mask can cause you to get sick. Now, if you notice, in the beginning of the pandemic, Fauci said, you don't need to wear a face mask. But then he changed it. He says, you need to wear a face mask. Now, 2 days ago on CNN interview, he says, wearing a face mask is just symbolic. It's just idiotic, absolute idiotic. You wear a face mask as a symbolic, so you get sick. Now, scientifically, surgical mask, you see, the surgical mask that everyone is wearing, this surgical mask, based on reviews and scientific facts, it says that you have 50% protection against bacteria. Not a virus, bacteria. Now, critical, we need to understand something. Let's do some critical thinking. COVID-19 is a virus. Face mask is protecting you against bacteria. Do you see where I'm going? Critical thinking, common sense. As if you have an umbrella that has all holes on it, and there is pouring rain outside. You open your umbrella, you're gonna get wet because the umbrella is all have holes and you're not gonna be protected. COVID-19 is a virus. If the virus can penetrate through cloth and this, then what is the meaning of wearing a face mask? Critical thinking, common sense. Now, let's talk about social distancing. We already know by now in New York, more than 66% of the people that they were positive in COVID-19, there were people that they were sheltered in. They were at home. How is it possible? There is no science behind social distancing. Where is the science? Then the governors and mayors, they keep pushing testing. The PCR test that they do, the scientist who invented the PCR test, who received Nobel Peace Prize, he said never use this for testing for any type of a virus because it's inaccurate. That's why you do testing. You have what? False positives, false negatives. Now, but what is so interesting is that all of this is happening. Our economy is destroyed. people, they stayed at home, violence is up, alcoholism is up, drug use is up, suicide is up. But none of these doctors, so-called doctors, and people that are in charge, nobody tells us what to do to protect ourselves. So staying at home, you're not protected. You wear face masks, it's all a lie. You don't have protection against virus. You may have protection against bacteria. So now more and more doctors, they talk about diet. And interestingly enough, I did a video a few months back. I talk about carbs and sugars and what kind of a significant effects they have on your immune system. Disclaimer, I am not a doctor, but I'm a person that I went and I researched because I had a problem and I had to understand how can I become intelligent and smart to deal with my problem. So, today I want to talk to you about something very simple. More than 50% of United States population is diabetic or pre-diabetic, meaning that excessive amount of use of carb and sugar. Now, I'm not going to go through it in detail because I have a video, I can put a link, you can go watch. Before I do that, there is a doctor, his name is Dr. Asim Malhotra, and I hope I'm telling his name correctly, that I want you to watch the video that he talks about the effects of the diet. Let's go ahead and watch the video and we come back and we continue.
Dr. Asim Malhotra, cardiologist from UK, has a new paper out and it talks all around what we've talked about before a little, and that's around dietary impacts on your immune health, your metabolic health, and how that might greatly affect if you're likely to have a serious outcome or not from the current situation. So great to see you again, Sim.
Always good to see you, mate.
Yeah, and you're just published in the European Journal, literally yesterday or today, I think.
Yeah, it was just published online last night. And basically, it's Covid-19, the elephant in the room. And it's about the fact that really what we should be promoting in terms of public health messaging is eat real food to protect the NHS and save lives. And I think we'll talk about the science behind that in a minute, but I think it's something that's really missing from the discussion. In fact, I would say, given the evidence that's there, it's actually negligent of public health officials, of government, to not give very clear advice that changing diet, making sure you're eating the right foods is crucial to reducing illness and mortality rates from COVID-19.
Yeah, and I couldn't agree more. And I had interviews with Dr. Ron Rosedale and Dr. Paul Mason in Australia and Dr. Steve Horvitz. All the same, the science, the mechanisms, everything lines up. This COVID situation, there's a 10 times or more risk for having poor metabolic health, possibly much more. And you can change your metabolism and get back metabolic health, we know, very quickly if you do the right thing. So yeah, we'll talk about what the right thing is.
Yeah, absolutely, Ivor. Couldn't agree more. And in fact, that's what I practice what I preach myself. But actually, more importantly, my patients are reversing their metabolic syndrome within 21 days of a specific plan that I give them, which is based around low carb. And we can talk about that. So we know that works with patients. We know there's good, reasonably good data that's published out there that shows this is also very effective in terms of dietary interventions. So it needs to be part of the mainstream discussion. Unfortunately, it's not getting, so far hasn't had that much in the mainstream media, other than maybe, there was obviously my interview a few weeks ago that you helpfully put out on your social media around my Sky News discussion on metabolic syndrome. But I think the evidence has accumulated even more since then that having chronic metabolic disease is a major risk for mortality. And I think what's more disturbing is that, only 1 in 8 people in the United States are actually metabolically healthy, which suggests 7 out of 8 are at risk. Now, of course, it's going to be to differing degrees depending on how many risk factors you have. But this also either applies to people who are not overweight or not obese. In fact, the evidence suggests from the US that in people over the age of 20, in adults basically, less than 1 in 3 with a normal BMI are actually metabolically healthy in terms of optimal metabolic health. So, I've said this before and I'll say it again. There's no such thing as a healthy weight, only a healthy person. So getting the right kind of foods in and the right diet is actually a message for everybody, not just people who are overweight or obese.
So now that you watched the video, let's talk about this for a moment. When you eat excessive amount of carb, you become either diabetic or pre-diabetic. Excessive amount of carb equals obesity, heart problem, high cholesterol, gut problem, vision problem, liver problem, and it can create heart disease, heart attack, and stroke. Now, what if, and why is it, first of all, none of this doctors, so-called doctors, that they tell us what to do with our lives today, nobody gives us this advices. You know what it is? It's very simple. Here's what you do. Here's what I did. You stop eating carb completely. Because if you don't eat carb for 90 days, you can reverse diabetic or pre-diabetic. You can go research about it, you can find out. This is what I do. I don't eat carb, I exercise, and these are the vitamins and minerals that I take. I'm going to list these vitamins and minerals, and then go read about it, research about it, see what do you think. Critical thinking. Vitamin D3. Vitamin D3, people in the United States, more than 70% of people, they're vitamin D deficient. It has enormous amount of effect on your immune system. Fish oil, you gotta have, I take 3 milligram every day. Selenium, I take vitamin A, I take magnesium. Again, most people are magnesium deficient, okay? And I take zinc. Now, why is it that nobody tells you that while you're sitting at home, don't eat carb, exercise, and take these supplements and vitamins so you can make yourself better? Because if you stop eating carb, and if you take these supplements, and if you exercise, you give yourself incredible amount of chance to beat any kind of a virus. Critical thinking, common sense. If I don't eat carb, my blood sugar will come down, I will protect my immune system, and then if you have a healthy immune system, chances that you can fight with COVID or any virus is extremely high. So now let's talk about something else also, which is very interesting. Our economy is in depression, and they keep telling us wear face masks, social distancing, and go to work. It's not sustainable. It is not sustainable. People, they get unemployment right now, and they say, why do I need to go to work? I'm making more money. Well, you are making more money until July 31st. What happens after July 31st? You see, the problem is here. I used to own few restaurants. Restaurant, it's an 18 to 20% to 22% net business. What does it mean? That means that most of it is cost. If you do everything right, if you're lucky enough to do everything right, you're going to have 18 to 20% net profit. Now, governors and mayors, they telling the restaurants, open the restaurants with 25% capacity. That's the recipe for bankruptcy. Why? Because if you work at 25% capacity, you're not going to make it. You can't even pay your rent. 50% capacity, you're not going to make it. 75% capacity, you break even. Where is the logic? Open a restaurant, work like a dog, day and night, at 25% capacity, 50% capacity, at 75% capacity, you break even. How can you survive? You see, here's the problem. We have turned and we became a society that nobody wants to think. You watch TV day and night, garbage and lies every day. Let me read something very interesting for you. Remember when this pandemic happened and Fauci said that if we don't do social distancing, if we don't stay home, more than 250,000 people will die. Every death is tragic. Every death. However, this is not being insensitive towards the death, but this is about the reality. Let me ask you a question. Did you know, before the pandemic, how many people they died in the United States every year? I'm going to read some stuff for you. 35,000 people, they died from antibiotic resistance. 35,000 people, they died from alcohol-induced death. 36,000 people, they died from falls. 41,000 people, they died from blood poisoning. 48,000 people, suicide. 56,000 flu and pneumonia. 65,000 people, accidental poisoning. 84,000 people, diabetes. 122,000 people, Alzheimer. 161,000 people, chronic lower respiratory disease. 170,000 people, all accidents. 250,000 people, malpractice, medical error. 600,000 people, cancer. 650,000 people, heart disease. If you add up all of these numbers, more than 1.5 million people, they die every year. What happens to you and I? We get up in the morning, we take a shower, you grab your coffee, eat breakfast, go to work. After that, you go see your friends, have a beer, go to restaurant, concerts, you go to your trips, you get together over the weekends. Nothing happens. Nothing. Today, we have 100,000 people, according to CDC, according to media, they have died from COVID-19. Dr. Birx, 2 weeks ago, she said 25% of those numbers are exaggerated. If you take 25% minus 100,000, that's 75,000 people. 2018, 80,000 people, they died from flu. 80,000. 100,000 people, which is the numbers are exaggerated, they died from COVID-19. We are in economic depression. So, critical thinking. Let's think about this. Let's think about all of this. Social distancing, wearing a face mask, flatten the curve. It's so interesting. Nobody talks about how we should protect ourselves, what we should eat. You shouldn't eat junk. You should not eat GMO foods. You should stop eating carb, exercise, take supplements, boost your immune system, no worries. But our economy is in depression. If we don't open up, we're gonna get even worse. So for people that's sitting out there and say, look, I'm making more money if I go to work, you're wrong. You can make more money if you don't go to work until July 31st. Once the pandemic assistance stops, August 1st, even if you want to go back to work, most of the jobs that you had, it's gone forever. That means unemployment will stay at the very, very high level for years to come. Until we start thinking, until we start using common sense, until we look at the facts, we look at the truth, and start having a critical thinking so we can change our lives. On that note, I just want to let you know that we have created a supplement for anxiety and stress relief, and especially today, most everybody has tremendous amount of anxiety and stress. It's called Anxiety Gone. It's made with all natural ingredients, made in USA, extremely important, made in USA, non-GMO. It is made in a FDA approved facility. You can get this, we're going to put the link below, AmericanBrandInc.com. You can go over there, you can get one of these supplements, you can use it, free shipping all over the United States. And I hope that we can start thinking and start using our common sense so we can go back to be land of a brave and home of a free, or home of a free, or land of a brave, however you want to look at it. But the most important thing is that critical thinking. Thank you for watching. God bless America.